Historically, we've had problems with anecdotal wait times for police extended to 3, 4, 5, 6 hours. We had situations where true accountability of that patient wasn't present in terms of who should take over the care. We've created a defined process that allows police a standardized approach to the delivery of those that are formally apprehended under the Mental Health Act. And as a result, the mean wait times have fallen below 50 minutes. And I think at the end of the day, no matter how big the political barriers might look or how big the issues might seem, there is an opportunity to create change when the right stakeholders are put together in the room.
The Clinical Support Rural Application Team is one of this year's recipients for the President's Excellence Award for Outstanding Achievement and Service Excellence. Over the last 2 years, this province-wide team rolled out and supported the Muse Cardiology Information System across rural Alberta. This software allows care providers to access patient health information far more quickly. Providers all across our province can now access a patient's ECG data almost immediately through this application, where in the past it might have taken several days to access. Having this data at their fingertips allows care providers to develop a care plan for their patients more quickly and leads to improved patient outcomes.
Research shows that there is a strong link between the regular excess consumption of sugar and chronic health conditions such as heart disease and diabetes. Our team makes a difference to physicians, patients, staff, volunteers and visitors in providing them access to healthy food and beverages. Various studies suggest that our eating and drinking habits are greatly influenced by the quality of our food environment. So we want to do our best in optimizing everyone's ability to access healthier drink options such as water, milk and fortified soy beverages. And as healthcare providers and as healthcare leaders, we truly need to set the example, and as many of our key stakeholders have repeatedly said to us, it really is the right thing to do.